Hello, I'm Matt, a pharmacist at Lloyds Pharmacy, and as we're now getting into flu and pneumonia season, I'm covering some essential bits of information about pneumonia that you'd need to know. Simply put, pneumonia is a serious infection that inflames one or both lungs, making it difficult to breathe. Pneumonia is usually caused by a bacterial infection, but it can also be caused by a virus like flu, which then increases the risk of pneumonia developing. Pneumonia causes the tiny air sacs in the lung tissue to swell up in one or sometimes even both lungs. When this happens, the air sacs fill up with fluid, causing a phlegmy cough, fevers, or even difficulty breathing. Pneumonia itself can be tricky to diagnose, as many of its symptoms overlap with other conditions such as the common cold, bronchitis, and asthma. When it comes to making a diagnosis, your doctor may ask if you feel breathless or if chest pain is worse when you breathe in or breathe out. If you've got a cough, they might ask how long you've had it for, as well as the colour of mucus and so on to help determine if it's pneumonia. The main way to prevent pneumonia is a vaccine. If you're over 18 and at high risk of pneumonia, we'd recommend getting the pneumococcal vaccine to help prevent the condition from developing. The vaccine protects against serious and potentially fatal pneumococcal infections, as well as the type of pneumonia caused by bacteria Streptococcus pneumoniae, also known as pneumococcal pneumonia. It's this bacterium that can lead to pneumonia and even meningitis. Most people only need a single pneumonia vaccination during their lifetime. However, this will vary according to age and any existing long-term conditions. Some may be offered a booster jab every 5 years. It's best to speak to your doctor or a pharmacist about the option that's right for you. Once you've had the vaccine, it can take between 2 to 3 weeks for it to take effect and keep you immunised from pneumonia. The pneumonia vaccine is available year-round, as it can be caught any time of year. That being said, the flu season and the winter months are an important time to get a pneumonia vaccine if you're deemed as vulnerable. This is because respiratory viral infections such as flu that can easily spread from person to person are more common in the winter, and these illnesses increase your risk of developing pneumonia. While pneumonia can affect people at any age, it is more serious for certain risk groups, such as the very young, the elderly, those with long-term conditions such as diabetes, or people with weakened immune systems. People that fall into these groups are more likely to need hospital treatment if they develop pneumonia, and so could benefit from extra protection. However, if you are 65 or over and have asthma, a chronic respiratory, heart or liver condition, or diabetes, you should talk to your GP first, as you could be eligible for the free NHS pneumococcal vaccination. As we've touched on, most pneumonia cases are bacterial, and the key way your GP can determine this is by listening to your lungs. If the one side is normal and the other side is unclear, it's likely to be bacterial pneumonia. This is because the bacteria impacts a section of the lungs and the inflammation affects the cells, filling them with air. When your X-ray comes back, the results will show an opaque area of the lungs if it's a bacterial pneumonia diagnosis. There's also another type of pneumonia known as viral pneumonia, which tends to develop from another infection. As an example, pneumonia that develops from COVID-19 would count as viral pneumonia, as it's caused by the coronavirus. Viral cases typically start with congestion or a cough, and a GP will be able to tell if it's become viral pneumonia through listening to the lungs, in the same way as they would with a bacterial pneumonia patient. If the breathing sounds are unclear on both lungs, it's likely to be viral, as the virus will be affecting both sides of the lungs. Our booking form for pneumonia vaccinations is available at LloydsPharmacy.com, and it's a simple and easy way to book your 15-minute appointment when it suits you, so you can beat the queue.